Daryl Quilliam, we're ready for another weekly Mayor's Message, and today, as you can see, I've got John from Royal Flying Doctor Service, and John's been kind enough, along with Jan Davis, to come down to talk to a few councillors and our General Manager about Royal Flying Doctors and the things that services they provide. So welcome, John, and tell us a little bit about Royal Flying Doctors and what you're doing in places like Circular Head.
Thanks, Daryl. Our primary area is aeromedical retrieval, so both emergency and patient transport, but increasingly we're getting involved going back to our own roots in respect to primary care as well. And so we're exploring what options we can do, and today's been a good exploration of that. Must be I've learned a few things. There's a few questions that I'll take back and come back to you on.
Thank you very much, and yeah, we've been talking about places of isolation, especially in Circular Head, and I know some families do struggle a bit, and if we could do some partnerships, that would be great. What areas do you think that would be important for places like Circular Head to do further work on?
I think you've hit the nail on the head. Isolation and access go hand in hand, and the RFDS was actually formed about providing services out to areas where they weren't there in any critical mass. So again, through the new technologies and others, but in our view, focusing very much, as you already are doing quite successfully, in prevention and promotion. So health, fitness, mental health, these areas keep people fit, keep people at home, keep people fed properly, exercised. They'll have a longer, happier life in that area and require our services less. Then we get into early diagnosis and prevention. So let's look at where we're not doing so well. For example, we know we're not doing so well in some of our cancer screening rates. If we can identify these areas earlier, it means that actually the health outcomes can be better, because again, that is what the evidence tells us. Then there's the provision of a whole range of services, and that's where we can come in as well, both as a facilitator, as an advocate, as a lobbyist, but also as an advisor in some of those areas, not necessarily a provider.
The other, I noticed last week, was at Hagfest, and I would expect that there's a number of people in Tasmania wouldn't even be aware that Royal Flying Doctor are in Tasmania. I mean, most people look at it around the outback and in northern Australia, like in northern Queensland, Western Australia and the Northern Territory, but in fact you do a lot of work in Tasmania, as I understand it.
Yes, we had the plane at the base at Launceston Airport, which was paid for by the community of Tasmania through fundraising. That was built there. We've got one plane based there, and that plane flies about 1,200 patients a year throughout Tasmania. The northeast and the northwest coast and the three Bass Strait Islands are our core area for movements, plus movements to and from Launceston, Hobart and to Melbourne for transfers. So it's a busy plane. It flies on average about 12 out of the 24 hours. So it keeps the pilots busy.
Thank you very much, and thank you very much for being down here today. It's interesting to hear from you, and I'm sure that we'll see a lot more of you in the future.
Yeah. Thank you, Daryl, and thanks for the discussion.
Thank you.